Okay, so next is hemostasis. It's V13. So what are the basic components of blood hemostasis? So blood components, if you talk about, it's blood vessels, blood flow, and viscosity of the blood, then platelets, plasma proteins, and a complex interaction between fibrinolytic pathway, complement system, coagulation. So there's a balance between all these things. And then describe coagulation. A hemostatic plug is formed at the site of damaged vessel to control the bleeding, and the first step is the von Willebrand factor adhere with the endothelium, then platelets adhere with the von Willebrand activate the things in the cascade and adherence and generation of a platelet plug. There is a coagulation cascade, formation of a strong fibrin mesh through the primary platelet plug. There is a sequence of enzymes and cofactors that generate thrombin, which cleaves the fibrinogen to produce fibrin. So thrombin is very important here. Now extrinsic pathway starts as the factor 7 is present in the plasma, binds the tissue factor in the presence of calcium. This catalyzes the activation of factor 7, which then activates the 9 and 10. Intrinsic pathway, kallikrein activates 12 in the presence of kininogen on damaged endothelium, which activates 11 and 9. Both pathways activates factor 9, which binds to the cofactor 8 in the presence of calcium that activates factor 10. Factor 10 complexes with the factor 5, phospholipid and calcium to form prothrombin complex, which converts the prothrombin to thrombin. So thrombin cleaves the fibrinogen, releasing fibrin, activates factor 13 and activates factor 5 and 8, generating factors 5 and 5A, which are cofactors for factor 10 and 9A. Very complex. What is the function of vitamin K? So it is required for the function of gamma glutamyl carboxylase. Gamma glutamyl carboxylase, the enzyme which carboxylates the factors 2, 7, 9 and 10, allowing them to bind to phospholipid and therefore the platelet surface. Without vitamin K, factors are produced but are not functional. Vitamin K deficiency affects the extrinsic pathway first because of the factor 7, which is involved in the initiation of extrinsic pathway, has the shortest half-life. With further deficiency, both extrinsic and intrinsic pathways are affected. What are the natural anticoagulant mechanisms? So nature has blessed us with antithrombin, which inhibits the thrombin, factor 10A and other activated clotting factors. We also have protein C. Pathway degrades and inactivates factor 5 and 8A, thereby blocking the thrombin generation. And tissue factor pathway inhibitor inactivates the factor 10 and 7A. Plasmin causes fibrinolysis by degrading fibrin into fibrin degradation products. It also inactivates factor 5A and 8A and disrupts platelet function. Plasminogen activates tissue plasminogen activator. UP activates plasminogen to produce plasmin. Vascular endothelium produces prostacyclin. It is a potent vasodilator that inhibits the platelet activation. What are the causes of coagulopathy in a surgical patient? So hypothermia, which can go to the cause the platelet dysfunction. Massive blood transfusion, packed red blood cells do not contain platelets, and stored blood rapidly loses the function of factor 5 and 7. Citrate may also cause hypocalcemia, which impedes the coagulation. Aspirin reduces the platelet function by interfering with the thromboxane A2 synthesis. Heparin directly interferes with the clotting and can also lead to thrombocytopenia. Sepsis can lead to DIC or bone marrow suppression. Postoperative estate, acute renal or renal failure can occur. How would you recognize coagulopathy in the surgical patient? Persisting small vessel bleeding, postoperative excess blood loss from the drains, purpuric rash and bleeding from the unusual sites, cannula sites, hematuria from uncomplicated catheterization. How would you confirm a coagulopathy? Platelet count, bleeding time, it's 3 to 8 minutes, test the platelet function, prothrombin time 9 to 15 seconds, testing the extrinsic and common pathway and the effect of warfarin, activated partial thromboplastin time 30 to 40 seconds, test the intrinsic and common pathways and heparin therapy, thrombin time 14 to 16 seconds, testing final common pathway, individual factor assay, fibrin degradation products, D-dimer, blood film when testing for DIC, thromboelastogram, measures the viscoelastic property of the blood as it clot in an environment resembling venous flow. This provides a measure of the clot strength and stability. Thank you.